And we have Dr. Anurag Varshne with us, and sir is going to be online with us, right? So just talking a bit about the speaker, Dr. Anurag Varshne is currently leading Patanjali Research Institute as Vice President of Discovery and Development. Let's give him a big hand of applause. So he's a seasoned drug discovery and development professional with 22 years of research and managerial experience. He is PhD from the National Center of Biological Sciences, Bengaluru, and postdoctorate from Yale University of Medicine, USA, and MBA from
हाँ शुरू तो कराइए अब मैं कर देता हूँ बाइंड अप आई एम वेटिंग देयर
Over to you, sir. Dr. Anurag.
For the sake of chairing this first session, I request Dr. Mahinder ji, Mr. Desraj ji, Krishna Goyal ji, Ish ji, Dr. Vinay ji, Dr. Atul ji to please join us on the dais. Please. And Assistant
Om ji,
Editor,
you're not audible.
Dainik Tribune, Arun Nethani ji is also with us. Please join us as a panelist also. From Delhi Doordarshan, this whole program is being covered, and we are thankful that the Tribune and all other press correspondents, those who are here, we are thankful to you for sparing this very, very precious time. And with us now, आपके पास आवाज आ रही है वार्ष्णे जी? Anurag Varshne ji, he is the one of the senior scientists of the world, and he is the pioneer of our research here in India, especially gut health is concerned, and he represents Patanjali Research Foundation from Haridwar, and he remained in USA for approximately 10 years and did studies and researches over there. Later on he came back and is serving the mother India. Over to Dr. Neena.
Sir, I think we can ask Dr. Anurag to start his work, whatever he wants to talk to us. So over to you, please.
ओके तो मैं शुरू करूं फिर?
Yes, sir, please.
यस सर शुरू कीजिए।
मैं कुछ अपनी स्लाइड शो कर रहा हूं, क्या वो दिख रही हैं आपको?
हाँ जी सर, दिख रही हैं।
Are my slides visible to you?
Yes.
Om. Om. Om ji?
Sir,
Om ji bhaji? So, good noon, everyone. Thank you very much for this opportunity, and I appreciate the invite from Haryana Aayog, led by Dr. Jadip Aryaji and the PGIMER Chandigarh, which has done a fantastic job of connecting this conference, which is focused more on integrated approach of gut health. So what I'll do, and I'm going to go very quickly about the efforts that we are putting it on for looking at uh, the integration of various systems and then trying to see how that can be taken it up for a holistic health, including the gut health. I work at Patanjali Research Foundation, and I'll take first 5 minutes to introduce the center and the institute where I work. So we are very blessed to be blessed by Param Shraddha Swamiji and Param Puj Acharji, whose blessings are there for us on a daily basis to guide the science that we have been focusing it on. So Patanjali Research Foundation was inaugurated in 2017, and these are the laboratories which have been set up to bridge the gap between the modern practice and our ancient medicinal knowledge, Ayurveda. These are probably one of the only kind state-of-the-art facilities to conduct the research on Ayurveda and yoga, top-of-the-line equipments, globally trained workforce, energize the research operations on daily basis. The mission of our center, the mission of our foundation is to improve the health and quality of life through research and innovation, and we do it by funneling the unstructured Ayurvedic and herbal information and the rich history of medicinal plant through a variety of filters, and our final target is to actually reach towards scientifically validated evidence-based medicinal system, and we would aim to get a very well characterized Ayurvedic herbal medicine, which would have an acceptability across the national boundaries of India and go beyond that as well. So our theme for reaching that target, our strategy has been based on 4 places: initiation, transition, actualization, and excellence. Right now, we are at the stage of actualization, and we are aiming to go towards excellence, where there would be a universal acceptance of Ayurveda as a treatment modalities. Now, when we talk about research, research strength and accreditations become the core component. So Patanjali Research Foundation has pretty much everything which is required to conduct the research. We have NABL accreditations, the laboratories are certified by DSIR, there is a full-fledged animal house with CPC compliance. We have an herbarium which take care of all the documentation of the various plants that we work with. Our laboratories are biosafety level 2 compliance. We have institutional ethics committee for conducting clinical trials. Most of our trials are approved by that committee and also registered as CTRI. In addition, we have 250-bed Ayurvedic hospital with NABH accreditation and an attached approved Ayurvedic medical college with PG approval in 8 subjects. 2,500 medical doctors are on the rosters with Patanjali, and the daily footfall of close to 30,000 patients happen across the India. Now, when we talk about the foundation that we work with, it has multiple segments, and for the interest of time, I will skip this, but I want to just make you see that the one we're going to talk today is drug discovery and development. We have a dedicated herbal research and painting and herbarium section as well that we can talk on some other opportunity. Now, what we do at drug discovery and development. So we have basically 5 major themes within there: in vivo biology, in vitro biology, herbal chemistry, and microbiology and clinical research. And what you see are just a glimpse of our infrastructure. These are very well loaded and equipped laboratories where the research are being done on a daily basis at a really cutting edge. Now, our approach for the disease, our approach to look at the science have been driven by the disease-driven approach. For example, we are focusing more on the various diseases and trying to find out the number of test articles, number of Ayurvedic drugs, number of medicines that we can try there. So what you see, those numbers on the screen are actually the number of medicines that we have tested for those areas. For example, we have let me get a cursor here. So we work on inflammation. We have close to 32 drugs that have been tested for these kind of diseases, metabolic disorders, cancer, neuroscience, and infectious diseases. So we have been working on that. The theme of the conference today is on gut. So I'm going to talk about how we can integrate the modern medical science with Ayurveda and how we can learn from each other to get things forward. So today I will talk about the gut disease that we have been focusing for last 3.5 years or so. And the disease I'm going to talk today is ulcerative colitis. So ulcerative colitis is actually defined as a chronic inflammation of the colon that produces ulcers in the lining, and the condition is marked by cramps, loose discharge of pus, blood, and mucus. And this also has a linkage with the alternation of gut microbiota, which affects the immunity, and it plays a significant role on the etiology of the disease. What I have been seeing that ulcerative colitis is affected at the age close to 30 to 40 years in common, and there is a lot of relapse remission that happens in the same disease too. If I see the epidemiology of ulcerative colitis, and there is a data for up to 2016, that it shows that it's very highly prevalent in Americas, in some part of Europe, Australia, and also now coming up very strongly in India as well. So this disease is universally spread out, largely linked with the basic inflammation, and sometimes also linked with the dietary habit of the people and what types of ulcerative colitis we have. So depending what part of the colon is being affected, where you have more inflammation, you can classify them in the 5 major sections. And what are the symptoms? The major symptoms of ulcerative colitis are bloody stool, diarrhea, pain in the rectal areas, abdominal pain, constant uh, urgency to go for defecation, weight loss, and fatigue. Generally, the reason that happens is actually linked with the variety of symptoms, but when you look for it, it also linked with the frequent fevers, dehydration, canker sores, eye pain, joint pain, anemia, because most of the time the food is not food is not reaching to the site as it should be, so general weakness happens. Nutritional deficiency comes up, and that comes in form of having a different kind of anemias, liver diseases, and the symptom, as we discussed earlier, mucus and pus in the stool. What are the current treatment options for ulcerative colitis? The first line is giving aminosalicylates, which are very common ones and given as a first line of defense in allopathic system. Sulfasalazine is the first one given. And then if that doesn't work, then we go towards corticosteroid, we go for immunomodulator later, and last line, if nothing works, then we go for colectomy. But those again has its own issues. Sometimes we have side effects, sometimes cancer, sometimes surgery is not so well tolerated. So these are the basic side effects or adverse effects, as we say, are being linked with the drugs which are being given for ulcerative colitis. And the list is not very exhaustive and is not very exclusive. These are the journal things that have been seen, as you would see for most of the drugs that is going to affect the inflammation. So what we have there in Ayurveda. So that's where I'm start to come for it. So what happens that most of the drugs in Ayurveda which are given orally doesn't reach really into the final form to the part of the gut. That means the colon is the lower part of our gut where the drug has to reach in a right way. So most of the time the enemas are giving. That means there is a rectal delivery of the drugs, which sometimes has a patient compliance issue as well, and it cannot be done easily at home too. So the idea there was that we actually took a leaf out of the drug development divisions, drug development process at allopathic system, where there is a possibility of coating the tablets with a specific compound that will make it entry coated. That would mean that we can coat the tablets that we have in Ayurveda, the extract that we have, and generate an entry coated herbal medicine. And that has happened at the first time at Patanjali Research Foundation, where we have developed and well characterized an entry coated cologrid tablet. So this tablet has polyherbal extract, total 7 of them, and which has a very well defined anti-inflammatory capabilities. But what more important is that this tablet is very stable towards lower gut, specifically at the colon. So what we did, we actually combined the wisdom of Ayurveda with the it together. And when I heard that this is the theme of the conference, I felt very excited because this seems like a nice case study to show that the integration of the technology also is as important as the pathy that we talk about it. So these are the components of Colograte. As you can see, these seven main plants which have been very well described in Ayurveda for taking care of the gut inflammation. First two are very well known. One is called Kutaj and second called Bale, which are the main component for the enema that has been given into the patients who have ulcerative colitis or IBD. Now, whenever we make any drug, any formulation, we actually prefer doing a very detailed chemistry. So the data you see on the screen right now, it's a ultra high performance liquid chromatography, UHPLC. And you can see that this drug, Colograte, is loaded with the really good compounds. And we use those compounds and generated them as a signature marker that can be then taken up later for looking for various batches of the same drug and see whether same are present throughout or not. Now comes about that what is the whole theme about it. And so Colograte has been formulated as an acid resistant, in other words, entry-coated tablet. So we all know that we have different pH system in our whole gut. In whole alimentary canal has a different pH system. So we start from pH 7, go up to pH 2 in the stomach, and later go back to pH and sometimes pH 7.5 in our small intestine and the large intestine. So if we make a tablet, for example, the blue part here, which is the main herbal component of a drug, and then coat them with an entry-coating material which will not dissolve at pH 2, which will remain stable here, we might be able to deliver the content of this drug towards the area where it should be reaching it first. With this hypothesis, we did the experiment, and the data is here on the screen. So this is a sort of a simulation experiment we did where we generated various biological fluids at a very specific pH. And we capped these tablets, for example, this is a mouth phase, we capped the tablets at the simulated saliva, which has the right amount of mucin and amylase, and pH was 7. Since we keep the food in the mouth not more than 15 seconds, we kept it there for 15 seconds. And after 15 seconds, this is a photograph. That means the tablets were as intact as they should be. And from there, we pass them into a simulated gastric fluid, which has the right amount of hydrochloric acid, pepsin, and salts, and pH was 2.5. And as you can see, this was kept there for 2 hours, 120 minutes, which is the normal time for drug to pass through the gut, through the stomach. And there you can see the tablet did not dissolve at all. It remained stable there. And then later we pass the same tablets into a simulated small intestine fluid, which has the right amount of bile salts, lipases, and other salts. pH was 7.0. And as you can see, at the end of 120th minute, the whole tablet gets dissolved very well. And then what you could see very easily that the availability of the components inside the tablets were there for whole cells to see. So we were very happy to see that the hypothesis we started with, where we integrated the drug formulation method from a modern science and complemented the science of Ayurveda, and we could generate something like that. Now, once we have that delivery, we got very excited. But can we then see a biological response for it? What you see on the right-hand side is just the data to show that, what is the release time and how much was there and what was the time kinetics for the same release. So we could see that from the 60 minutes onwards, the release start to happen. Now, here we see the biological response. In the next slide, if I can move. Uh-oh. Now, once we found that we can get the Colograte release very well, then we start to see what are the biological response we can look into it. And the easy thing to do is to first look at the human macrophages, because these are the basic immune cells and they respond very well to any invasion of bacteria or virus. So we took LPS, which is the compound present on the coat of the bacteria, and then we actually hit them with these cells, THP cells, we hit them with LPS and also then co-treated with Colograte. And as you can see, if we measure the level of TNF alpha, which is a very well-known cytokine, we can see that with LPS alone, there is a right amount of TNF alpha release. But when we treat with Colograte, these start to decrease, and at 100 microgram per ml, there is a significant decay in the total amount of TNF alpha released by THP cells. Similarly, we look for IL-6, which is one more cytokine that's like a master controller. There we saw a much stronger response. In addition, we also look for NF-kappa B, which is a transcription factor that controls the secretion of other cytokines. And we could see that in that case too, Cologrid could actually reduce this and could actually show that yes, indeed, the components of Cologrid are sufficient enough to have a basic anti-inflammatory response. So we could showcase, yes, indeed, what we saw is in the immune cells, but what happened in the intestinal cells. So we then moved towards a cell biology of intestine and started to look in a human colorectal cells, ST29. And we did a very fancy experiment where we took the monocytes, which are there in the blood circulation, and see if those monocytes can adhere to the human colorectal cells. And we label those monocytes with some dye. By measuring the fluorescence, we could see it, yes, indeed, the adhesion happened. And if that adhesion, which is a hallmark of cytokine-induced inflammation, can be controlled, that by using Cologrid. So this experiment, I would like you to focus it here, where we are just looking for the adhesion of U937 cells, which are the monocyte, which are attached with human colorectal cells in presence of TNF-alpha. You could see there is a nice amount of adhesion happen from untreated control versus just TNF-alpha. But when these are co-treated with Cologrid, you could see the adhesion was going down in a dose-dependent manner. So that was a good marker. And from there, then we moved ahead and looked for various gene expression. One is being IL-8, which is interleukin, and we could show that indeed, yes, IL-8 level was also decreased by Cologrid. Similarly, IL-1 beta also got decreased there too. And we also look for CXCL5, which is the gatekeeper protein for these kind of adhesion, and we could find, yes, indeed, the addition of Cologrid decreased that expression too. Now, when we're looking into the other models which we do in our animal systems, we look for DSS, which is dextran disodium sulfate, that causes a lot of huge damage to the human colon epithelial cells. So we then use the same insult to the cells. We took DSS and hit those caco2 cells by DSS. You could see that addition of DSS caused a huge drop in the cell viability. The cells start to die. And then when these cells were co-treated with the intestinal phase digest of Cologrid, we could see very nice recovery. That means the Cologrid, which was digested in a simulated intestinal fluid, we could see that yes, indeed, the cell viability can be restituted. And that is linked very well with the ROS level, which is reactive oxygen species level, which is very well linked with the cell viability. So we could see in the situation when there was a lesser amount of viability, there was a more amount of reactive oxygen species. So we could see this rise in ROS can be decreased by Cologrid, and which in turn get translated very well in the recipe of the cell viability. So we could see together, yes, indeed, Cologrid does what it's supposed to do in a various cells of a human system, which can be linked very well with the gut biology. And this is just a valuation of the drug when we make it. Let's see what's the diameter, thickness. This is more of a formulation parameter, but sometimes we have to show that. And this is the design of Cologrid box that shows that this is probably the first Ayurvedic drug which has been entry coated for a human use. So once we complete all this data, as usual, with the blessings of Acharji and Swamiji, we actually send it out for publications, and we are very happy to report that Cologrid have been published in a very nice journal, Phytopharmaceuticals, where we could see that in this tablet indeed has an anti-inflammatory response in ulcerative colitis like in vitro models, and that modulate NF-kappa B centric signaling axis. So what I believe that this is actually a pretty good, strong case to show that integrations are possible for different pathies, different therapies, and combining the Ayurveda with allopathic systems, yoga with Ayurveda, and all crisscross things are possible. But at the same time, integration of evolving technologies, learning from each other also becomes very critical. So this is the small little case study I try to show that we strongly believe here at PRF that integration is a need of hour, which will take care of various chronic diseases. Gut diseases is one of them. So amalgamation of this ancient knowledge with the modern pharmaceutical technologies would be the right step in that direction. So with that, I would like to thank all of the people who are there in audience and the organizers again for giving me this opportunity to talk about the work that we have been doing at PRI. Thank you very much once more. Om. So if there are any questions, I would be happy to take those. I see a hand raised from Dr. Piyush Kant Mishra ji from Lucknow. If that's a question, I would be very happy to answer.
Okay, right.
Thank you, Dr. Sab. Your session is very good, but I want to know the symptoms of the ulcerative colitis and the remedies. What we will prefer in Ayurvedic, in terms of Ayurvedic medicines.
I think that's a very relevant question. The symptoms are very well defined. I think in my earlier part of the presentation, I discussed those. There is the first thing is that one sees a bloody stool, and which linked with the pain and the constant urge to defecate. And those symptoms, if for longer duration, lead to the inflammation of the gut. Now, the treatment that you go for is generally bale and cuttage. What we have done is we have taken the good component of those two herbs and combined with 5 more and generated a tablet which will deliver these herbs and their extract at the right place, at the site of action. So Commemorate, I believe, is a very strong option for taking care of the ulcerative colitis and other gut diseases like that.
Okay. In preliminary stages, can we cure by Ayurvedic or we have to go for English medicine?
I think when we talk about integration, that means the option exists for both. So in integrated approach, I think the option should lie in the hand of the patient at what therapy they would like to do. Being an Ayurvedic researcher, I believe that the power of Ayurveda exists to actually take care of these diseases too. And if it is a starting of the disease, I'm sure that taking this medication to a given patient would have a therapeutic benefits.
Okay. Thank you, Dr.
Thank you very much. Pranam.
Thank you very much, sir. Do we have any questions from the students? Yes. Yeah, sure. So we have certain questions. Yes, you're audible. You're audible.
Now, yes. Suppose one patient is on herbal diet, completely vegetarian diet, and the patient doesn't know that he is having this ulcerative colitis. Already he is on very soft and simple diet, the fruit diet, the salad diet, and the boiled veg diet, and not the harsh rajma chawal, kadi chawal, and all these things, and puri and chole. After 3 months, he complains about some blood in the in that fecal material, because he is under, or he or she is observing herself that there is some blood. Then she goes for the test, one proctoscopy, then endoscopy, and the third is again some cholecystoscopy, which takes a lot of time in itself in PGI, because the patient will be taking, the process will be taking maybe more than 1 month in getting the number, in getting the date done, whatever. Till then, how can we treat the patient?
I think that's a very nice description of a case, and I'm sure most of the clinicians of Ayurveda and other field too would get benefit by such a good detailed explanation of the case. But what we have seen here at Patanjali, we get a lot of patients with the ulcerative colitis, IBDs, and Crohn's disease. There, the the treatment starts from the point the first event is detected. That means when the first blood or the mucus is spotted in the feces, I think at that time treatment startment would be a very good idea. But again, I am a researcher. The clinician would be able to better judge this and advise what treatment should be given at what time. But thank you. It was a very nice question.
Right. Uh, should I repeat the question? Okay. Thank you, sir.
Maybe I will be taking up the question in my.
Sir,
But whenever you talk about bleeding from any part of the body, now one of the slides that I have shown in my presentation is that for the colon there are about 13 reasons which that slide shows. But if we really go into the theory, there could be even more reasons for the cause of the bleeding from anywhere, from intestine, from your mouth, from your nose, from your urine. So whenever the bleeding occurs, it simply means there is something which is injuring our mucosa. It could be colon or any part of the body, maybe vagina or whatever is it. So what we as a clinician will be interested to know that what is causing bleeding. There is no treatment of bleeding. The treatment is of the underlying cause of the, for example, in hemorrhoids, which maybe majority of the population suffers, the cause may be constipation, which ultimately leads to collection of the blood in the hemorrhoidal pouches and the bleeding. Or it could be as serious a disease as a malignancy. So as a clinician, first of all, I have to, now you see, here is the importance of the history of the person when we examine the person. So we try to find out that what is the likely cause. So commonly people develop common infective diarrhea which have got bleeding, you give common medicines to them and it disappears, you do not need a colonoscopy. But whenever we are talking about ulcerative colitis or Crohn's disease or any, first of all, we need to establish the diagnosis. So unless you look at the mucosa, you take a biopsy from them, it's not possible at all to say what disease you are, because I said you, 13 की तो list मैंने वैसे दिखाई है, be 23 or 33 also. So now secondly, now I am dealing with lot of clients online consultation. In most of the developed countries, it takes 9 months, 1 year to even meet a super specialist. It's a wonderful country of India where you can go and meet a super specialist within hours and minutes. And if I clinically feel I need a colonoscopy, I'll do it tomorrow morning. Why 2 months or why 3 months? Tomorrow morning we'll do colonoscopy, we'll have a look, and at least we'll have an empirical impression whether it is ulcerative colitis, hemorrhoid, fissure, or it is a malignancy, or it is a simple amoebiasis. And we'll take a biopsy and within 2, 3, 4 days, we'll get the final diagnosis. Empirical treatment we will start tomorrow morning, and at least now we will start whatever we feel is now. Now patient is so severely anemic, his hemoglobin has fallen down, maybe he requires hospitalization, or there's nothing, he just had apprehension and anxiety. We'll reassure him, because he drink a lot of fluids, plenty of fluids, go, kal subah dekh lenge. So the things are not difficult. There's a very systematic way, and it can be diagnosed now very easily, and they can be treated also very easily.
I have a question to Dr. Anurag, please. Sir, you have talked about the ulcerative colitis, and your research work is very good. My question is there any Ayurvedic approach towards the Crohn's disease? Kindly elaborate, please.
We have done a similar research for the Crohn's disease as well, and the data is still under analysis, but I can tell you that colograte component has a good impact on that disease as well. The clinical investigations are going on, and we are also conducting clinical trial at 2 places, and of course it will take almost a year to conclude, but the first preclinical data shows it really works very well there too.
Okay, thank you, sir.
I think any more questions we can take in the end, maybe the other speakers would cover in their content. So you can keep your questions and prepare for your exam, ulcerative colitis, right? Okay. We welcome our next speaker, Dr. Manjeet Singh Trehan. इससे पहले कि हम नेक्स्ट स्पीकर लें, किसी का फ़ोन रह गया कहीं पे, कुछ इम्पोर्टेंट हो तो वी कैन ऑलवेज सी. द फोन इज़ विद मी. So, sir is presently the Additional Director, Internal Medicine, Physician and Gastrointestinal Endoscopist at Fortis Medicenter, Sector 11D, Chandigarh. And he is a consultant of Diet Insight Wellness Center. And he's done his MBBS from IGMC Shimla in 1987, MD Medicine from PGIMER Chandigarh, and senior residency also in internal medicine, rheumatology, hepatology at PGIMER Chandigarh. And sir has got so many publications, textbooks in neurosciences, chapters in books related to geriatrics and neurosciences, publications in national and international journals, and editor of a module on management of common conditions and emergencies, including first aid, for IGNOU School of Health Sciences. And sir had been formerly the senior consultant, SMO, and teacher and guide for DNB medicine department at GMS Sector 16 Hospital, and nodal officer for district immunization officer, National Viral Hepatitis Control Program at Chandigarh, National Program for Prevention and Control of Cancer, Diabetes, the main NCDs which we have, and National Tobacco Control Program. And sir has worked a lot during COVID period, so was quite on his toes running around. So he is the General Secretary at Chandigarh Physician Forum, former, and Chandigarh Panchkula Physician Forum Vice President, IMA Panchkula. And sir, we welcome you for your talk, and we would limit the time to 20 minutes, please.
Thank you very much for inviting me for today's wonderful activity. So, my topic is gut health, and I'll request the organizers that kindly point me out when my time is over. So, regarding gut, I'll say that let us try to simplify the subject, making it complicated. Now, somebody who's got a car needs to know the driving of the car, otherwise he will be leading to the accident. The same way, by God's gift, by default, at birth we get our gut, heart and liver and everything else. So it's better to understand in a simplified way, because for everybody, if you want to teach him a gastroenterology level of book, I think it will be very difficult, life will become very difficult. And indeed, the things are in fact simple. They are not very difficult also. So, but if we just go by the definition that good gut health is defined as the effective digestion and absorption of food, the absence of gastrointestinal illness, normal and stable intestinal microbiota, effective immune status, and a state of well-being with a normal quality of life. Now you see, in order to prove anything which is right or wrong, it takes years and sometimes decades and sometimes centuries. That is how the science evolves. It doesn't happen overnight. Something which I want to promote, which I have produced today, I can promote it as a business product, but in order to prove its worthfulness or its utility or in a scientific way, it may take years and years together. In the meantime, I can do a lot of business and I can make a lot of money also. So why I'm saying so is that now somehow we don't need to require to sort of sit into government buses, but when we were young, that was the only source of transportation. तो बस के अंदर लिखा होता था सवारी अपने सामान की खुद जिम्मेवार है. Transport department is not responsible. So my health is my responsibility. There's a lot of information and there's a huge amount of disinformation. So it's up to us that from where do we want to collect it, and from where we want to restrict it, and where do you want to see it with the eye of suspicion. And I also understand that majority of the friends sitting here are from the nursing profession, so my focus will be all of them. And you see, when we are in the medical profession, everybody in the society, for a good reason, they listen to us. Whether they follow us or not, it is up to them, but at least they take our opinion, they want to discuss. So sometimes our opinion value a lot. So thereby meaning that our value, our opinion should always be backed by a scientific information, educational component of it, not ki suni sunai baatein. So that is very important. And for that, what we are taught, when you start your career in the first year professional student, we are taught the anatomy. Hum gut ki baat kare, what is esophagus, what is stomach, what is small intestine, how do they look like, how they are made, how do they work, how do the diseases come in pathology, we learn. How do we investigate, how do we reach at a conclusion, and how do we treat, and how they are likely. So that is what we have been taught. And the science is an ever-growing phenomena. So at one time MRI was not there, prior to that CT was not there, endoscopies were not there. So yes, we used to think something else 30 years, 40 years back. Now we understand, we have learnt more. So as the science evolves, we also understand. So it is best for we people to learn the best possible. And if a question I do not, so going with that information, so as I said, there's a lot of misinformation is also. So this is a very common saying. I think we learned this story कि अगर कुछ अंधे लोगों के सामने हाथी आ जाए तो how will they explain the elephant? And that happens, and sometimes the person may be too confident that somebody who's seen the tummy, he will explain you that elephant is nothing like but is a wall. Because he has seen only the wall, he doesn't know the subject beyond that. And another person, depending upon whether he is at the leg or he is looking at the rope, so sometimes the little information or incomplete information, especially if the teacher is very authentic and very strong, that becomes a problem for all of us. So in fact, it is important. And when you want to talk about this elephant's knowledge, you see this is available when we talk about corporates, when we talk about very hard-working, intelligent villagers, where these various global citizens, they have shown from the Mongoloid look, from our religious preachers, and even the modern generation also. So if our information is incomplete, obviously, in order to keep our sort of whatever I have said, my ego should be set right. So whatever I will be saying, I'll be sticking to it. So, but it is important for all of us to go to the real cause of it, that what is, so if you see this, one of the things, that what all things can affect your gut health. So in fact, gut health is not a separate component or entity when we talk about health. Health, in fact, if your gut is okay, your tummy will be, your liver also has to be okay, your heart has to be okay, your body's other structures have to be okay, and your mind also has to be okay. अकेली esophagus बहुत बढ़िया और बाकी सबका बेड़ा गर्क हो गया, तो what is the purpose of that healthy esophagus? So gut health per se is not a very sort of compartmentalized or a single entity. So, but all these things when you talk about sleep, probiotics, diets. Now here I come that especially when you talk about, you go to literature, or these days the easily available literature is in your net. So when you talk about gut health, everybody will start talking about probiotics, or somebody else, whatever the product has to be sold. I don't say that probiotics are wrong or they are right, or everything has got a limit. Everything has got certain beauties, and there will be certain limitations. So yes, beauties of everything must be utilized, but if we think that one thing can do all the things, I think probably that may not be really true. So again, so much components. They talk about anxiety, they point out IBD, IBS, and various other diseases, and somebody may have a beautiful thing for. So this is another thing what I was finding, a lot of wellness people are there now these days in the market, because as one of our questions was कि PGI में तो 3 महीने लग जाएंगे. It's okay if there's a rush, a lot of rush is there, and investigation sometimes they may take time. So there will be a lot of people. So a lot of literature on this, lot of treatments for this. Yes, we do know, we had the previous lecture, there is an inflammation in the gut, certain diseases we know there can be leakage also, but sort of syndromes and leaky gut syndrome and all, a lot of treatment. That's why I thought that all those chapters which are not written in our book should always be looked at with the suspicion, unless that are medical literature. So this is something to be written off. So very commonly used subjects in my home, in my friend circle, in all circles, आपका जी जिगर कमज़ोर है, आपका मैदा कमज़ोर है ना, और आपका मैदा ठीक से काम नहीं कर रहा, आपको मैं लिवर टॉनिक देता हूँ, हाजमा खराब हो गया, हाजमे की दवाई ले लो, धर्म पड़ गई है, ठीक है, नाभि हिलना अगेन, एंड इट इज़ इवन इन द यूरोपियन एंड वेस्टर्न कल्चर ऑल्सो नेवल डिस्प्लेसमेंट. हम धर्म की बात करते हैं, दे टॉक अबाउट नेवल डिस्प्लेसमेंट, कॉडी गिर गई है, एंड देयर आर लॉट ऑफ पीपल हु गिव ए वंडरफुल मसाज टू सेट ऑल योर इंटरनल ऑर्गन्स ऑफ द बॉडी. सर्जरी किए बिना सारे ऑर्गन को सेट कर देते हैं, वो लिवर को भी सेट कर देते हैं, आपकी अम्बलाइकस को पता नहीं कहाँ से सेट करते हैं, जो कि सो lot of such things are also available in the market, which are not the true medicine. Actually, that is not the gut health, but yes, soda based thing. And there's a structure which I never found in my anatomy book. So this was one of the very different way to explain the anatomy, which none of our anatomy professors could understand. So they will be having all sorts of things, but then it is important. So then another topic, gluten intolerance. It has become a rivaj now. गेहूं बंद कर दो, दूध बंद कर दो. अगर उनसे if you ask that person, have you stopped your gluten? No, he would have not stopped it. And especially I'm saying that during last few years, I've come across so many people who sincerely agreed to the advice of गेहूं बंद कर दो without any reason, and they were really crying कि जी मैं तो चपाती और पराठा खाए मेरे को मुद्दतें हो गई हैं. And when we evaluated, there was no scientific reason to say that you have. Yes, gluten sensitivity is a known disease. It is a very well known disease, and we go to the extent to tell to the people कि अब जिंदगी भर आप गेहूं नहीं खाओगे. Yes, that entity exists, and we also tell them to go to the diet experts so that you get 100 alternatives also. अब गेहूं नहीं खाएंगे तो suicide थोड़ी करेंगे. But nature has given us so many other things also, so that does exist. But telling everybody, किसी को स्किन पे खारिश हो रही है, फिर ये ग्लूटेन हाइपर सेंसिटिविटी, किसी को छींके आ रही हैं, तो दिस सॉर्ट्स ऑफ मिसइंफॉर्मेशन इज ऑल्सो व्हाई आई एम टॉकिंग सो इज कि दीज थिंग्स आर प्रेवलेंट. आई कम अक्रॉस एवरी डे इन माई प्रैक्टिस. सो व्हेन वी टॉक अबाउट द कॉमन पीपल, तो विल बी देयर. सो दैट इज अबाउट दिस थिंग. So just coming a bit to a few of the organs when we talk about gut, so esophagus. So what are the risk factors? सबसे बड़ी बात जो definitely proven है worldwide is cancer, because it's a life-threatening. Everybody is scared of it. A lot of data we have got over last decades or maybe centuries. So these are few of the things which we scientifically know. There is a cause and effect relationship. World over they have been studied. Any of you can start a data collection. You can work upon your people and you can prove it 100 times and 1000 times, the results come same. So that is what calls is the reproducibility. If you do the study, results are same. If I do the study, the results will be similar. So tobacco, alcohol, opium, hot drinks. Hot drinks means anything which is hot. ठीक है, which is burning your esophagus. Hot means it burns. So obviously irritation we know is a cause. Carbonated soft drinks which are so lovable to all of us, and even to the extent they say pickled vegetables. What is there wrong in the pickles? It is an irritation. But सारी दुनिया pickle खाती है, क्या सबको कैंसर हो गया? No. So it means there's a lot of biological predisposition also. We all are genetically different people. Somebody gets the diseases and somebody doesn't get the diseases. When we talk about the data, it is about how the society is behaving. क्या 100 esophagus खाने वालों में से एक ही पिक्कल की इशू थी, लेकिन 100 में से 99 की तो पिक्कल की हिस्ट्री थी, लेकिन जो 100 को नहीं था उनकी पिक्कल की, तो देन प्रोबेबली इट बिकम. इट डजंट मीन कि कल से अचार खाना बंद कर दो, दैट डजंट मीन, बट दीज आर द रिलेटिव रिस्क. कोई एक आदमी है वो हल्की सी मिर्च खाता है ना तो उसकी हालत खराब हो जाती है, एक बंदा 10 मिर्चें भी खा जाता है तो उसको कुछ भी नहीं होता. So individual differences may be there, but these are the entities which have been so then very important part, low intake of fresh fruit and vegetables. This is related to almost most of the cancers, vitamins and mineral deficiencies. And then various medications like non-steroidal anti-inflammatory drugs. हम पेन किलर सारे लेते हैं, तो does it mean पेन किलर बुरी होगी, वो तो मार्केट में बिकने नहीं चाहिए. So many time people will say कि जी मेरे घुटने में दर्द हो रही है, मेरे को क्या दोगे, पेन किलर तो नहीं दोगे. भैया पेन के लिए पेन की दवाई देंगे ना यार, मलेरिया के लिए मलेरिया की दवाई देंगे. सो पेन किलर्स आर नॉट बैड. इट इज समथिंग ऑलवेज लाइक न्यूक्लियर एनर्जी. आप न्यूक्लियर एनर्जी से न्यूक्लियर पावर स्टेशन भी चला सकते हो और न्यूक्लियर बॉम्ब भी बना सकते हो. इट इज़ द वे यू हैंडल इट. But in beyond a limit or maybe in a predisposition, H2 receptor, the ranitidine, famotidine that we so commonly know, even they have been attributed. If you go back into literature, there's a scientific reasons to understand, but it doesn't mean you stop taking ranitidine. It is a life-saving drug wherever you need to take. So then various infections and various other chemical carcinogens and chronic gastroesophageal reflux, such a common problem, achalasia and gastric atrophy, medical people know these words, and certain occupation like silica and asbestosis. So how can we prevent? Obviously, we know the things which are bad. We know smoking is bad, tobacco is bad. They say alcohol can cause Sankardev very hot. Even there's a data from PGI regarding C esophagus that drinking a very hot coffee or very hot tea can cause these types of issues. So again we call to liver because such commonly used कि आपका liver खराब है ना, such a wonderful and a beautiful organ 100 साल तक चलता है, इतनी जल्दी खराब भी नहीं होता. 2 बोतल दारू की पीने वाले पी जाते हैं, but it doesn't mean that is the right thing. So these organs have got a lot of reservoir with them, lot of reserve is there, even up to 80-90% function. So every now and then doesn't happen कि जी आपका जिगर खराब हो गया, आपका liver खराब हो गया, मैं liver tonic देता हूँ. So that is something very important to understand. And when we talk about risk factors, it is hepatitis B. It's about 100 times more common if you have got hepatitis B versus you don't. Hepatitis C, non-alcoholic fatty liver disease, that is obesity and diabetes, alcohol, certain fungal toxins, glycogen storage diseases, and certain other diseases also, including smoking. So how can you get prevention? So whatever the known viruses there, I think everybody in society in 2023 must be protected against hepatitis B because of vaccination. And anybody who's got these viruses, B or C chronic infection, they should immediately, they should be getting treatment from it. So again, when we talk about the colon, old age is a risk factor for the cancer, yes. The more older we get, the more cancers we are likely to get. So that is a known factor with each and every cancer, most of the cancer I'll say, and so equally true with the colon. And certain, those people who have got a past history in them or family histories, inflammatory conditions, we were talking about ulcerative colitis, Crohn's disease. Yes, one of the reasons we want to treat ulcerative colitis very effectively is the prevention of the cancer. And then certain inherited syndromes, family history of colon cancers, and very important factors in day-to-day life. People may not be smoking, they may not be drinking alcohol, but not taking enough fruit, vegetable, salad itself is a risk factor. A sedentary lifestyle. Now, present scenario, IT jobs, various jobs, sitting for 10 hours, 12 hours, computer and all, yes, we have to do it for our bread and butter, for our profession. But in addition to that, we need a good amount of physical activity of diabetes per se, obesity, smoking, alcohol, various radiations, and how you can prevent. Again, the incriminating factors we need to avoid, the various preventable viral infections, vaccination should be taken, healthy life can be, we all should be leading healthy life. Today we are in a group from the Aayog, and that is something beautiful thing we have inherited for centuries with us and excellently promoted in the last few decades. So that's a wonderful way to prevent all diseases, including these type of cancers. So symptoms of the colon cancer may be anything which is wrong with the colon. There's a bleeding, there's a constipation, there could be diarrhea. So whenever symptoms are going towards these organs and they are not responding to the usual day-to-day treatment, I think they must be investigated. So just last, I think maybe the slide I was talking about the GI bleed, blood coming from the anus. So this is at least of a list of 13 diseases, which I said you probably still is incomplete list. And so unless you have looked into it, how do you know that what is causing bleeding? It's a very common saying, गर्मी हो गई कल राती अंब खाया सी मूंगफली खाई सी nasal bleed है कोई भी bleed है they are attributed so called गर्मी होगी तो गर्मी का मेरे को तो पता है जो थर्मामीटर में टेम्परेचर ज़्यादा दिखे वो मेरे को गर्म दिखता है जब मैं फ्रिज में से चीज़ निकालता हूँ वो मेरे को ठंडी दिखती है उससे ज़्यादा जो गर्मी और सर्दी है that's again a very difficult subject sometime for me to understand. So I will say that the things which are not scientifically validated. So when we come to gut health, ultimately what is important? Smoking, various form of tobacco, alcohol, various preventable virus like hepatitis B, vaccination, exercise. Nothing can beat good exercise program. And I think everybody, right from the day a kid starts walking till the day he leaves this world. Exercise should be part and parcel of our life. It could be yoga, or it could be anything which you love or you do. And weight management is important. Then diet. I think our basic Indian diets, all Indian diets, और धार्मिक सभाओं में जाओ तो रूखे सूखे सिंपल भोजन की बात होती है. That's really the beauty of the health. And food hygiene. So means it should be, the commonly people go to शादी और a party जब क्या होता है तो क्या होता है कि उस दिन पनीर खा लिया था, नहीं कुछ नहीं, components are not important. It is the hygiene which is important. चाहे शादी में है चाहे 5 star में, पता नहीं at the back end क्या हो रहा है. So food hygiene then becomes important so that we can be prevented from this thing. So I think this is the last slide. मेरी वो thanks वाली कहीं चलेगी, but thank you very much everybody. So any quick question I can take. With all due regards to all existing, present and alternative system of medicine, we are here to learn from everybody. Anybody who's got good things must be shared. We all must learn from each other. हमें भी आज ये बातें कैसे पता चली, क्योंकि हमारे सारे टीचर्स ने सिखाई, सब लोग बताते थे, हम लोग यहाँ पे बैठ के सुनते थे, आज भी सुनते हैं. तो that is the beauty. All systems are great, but we all must be knowing our limitations also. जब हम भगवान बन जाते हैं ना, फिर बहुत गड़बड़ हो जाती है. तो we are human beings. Yes, we have water capacities. हमसे ऊपर कोई और भी होंगे, उनकी भी मदद लेंगे. Referral system is an excellent system. I am not the end of the system. So that all beauty should be investigated. But whenever the disease looks ferocious, it's a sort of troublesome, we should not be delaying in taking. When we talk about various cancer, the earliest we diagnose, the better is it. जल्दी पकड़ेंगे, क्योर हो जाएगा, जिंदगी बढ़िया चलती रहेगी. थैंक यू.
Heartiest thank to our Honorable Dr. Manjeet Singh जी. जितने अच्छे से आपने उसको कवर किया गट हेल्थ को, मुझे लगता है कि आनंद की स्थिति है. सब लोग बहुत आनंद में थे, समय रुक गया था. एक बार आप सबकी ओर से पुनः डॉक्टर मंजीत जी का बहुत बहुत अभिनंदन. और उन्होंने साइंटिफिक बेस्ड बात की है, और जो बात कही है वो बहुत गहरे तक है. चाहे वो स्मोकिंग और टबैको की बात करते करते उन्होंने पूरे भोजन की पद्धति की बात की है, वेट की, और सबसे अच्छी बात कि हर रोज जीवन से लेके अंतिम श्वास तक आपको अपनी मेंटेन करनी है, तो आपको एक्सरसाइज जरूर करनी है. तो सेडेंटरी लाइफस्टाइल जो है ना, ये सबसे बड़ा एक पार्ट है जो गट हेल्थ को डिस्टर्ब करता है. और ये आप लोगों को पता है, जो व्यक्ति एडमिट होता है हॉस्पिटल में, उसकी सेडेंटरी लाइफस्टाइल होता है, और कहीं सबसे ज़्यादा इफेक्टेड होती है उसकी गट हेल्थ. तो मुझे लगता है आदरणीय डॉक्टर साहब का बहुत अभिनंदन. और जो उन्होंने बात की तासीर की, कि तासीर कैसे, वो एविडेंस बेस्ड नहीं है, परंतु हमें ऐसा लगता है कि कई बार आम गर्म होते हैं तो बिना गर्म पानी में रखे खाए जाते हैं तो हो जाती है नक्सी. आ जाता है ये विषय, क्योंकि हमने देखा कि हम बचपन में माताएं सिर पे पानी की तो थोड़ा सा या बर्फ़ रख देती थी तो इफेक्ट होता था. बेल का भी हम बात कर रहे थे, डॉक्टर वार्षिनी ने बात की, कुटज घनवटी की बात कर रहे थे, तो बेल बहुत इफेक्टिव है पेट के लिए. और दूसरी आपने बात की जो इन्फॉर्मेशन शेयरिंग की बात है, तो जो हमारी गट है, जो स्टमक है, वो एक जैसा लगता है जैसे हमारी लौकी होती है. तो लौकी का उसका बड़ा इफेक्ट है, हाईली इफेक्टिव है लौकी. और उसका जूस, पेठा की बात आई कि पेठा गट हेल्थ को फिल्टर करता है, साफ करता है, बहुत हाईली इफेक्टिव है. और लीवर के लिए अभी डॉक्टर ज्योति हैं आपके साथ, अभी बात शेयर करेंगी. तो एक बार जोरदार अभिनंदन आदरणीय त्रेहन जी. वैसे बहुत बड़ा नाम है डॉक्टर त्रेहन का नाम. यदि हार्ट की बात की जाए तो हम डॉक्टर नरेश त्रेहन की बात सुना करते थे. तो आप, मुझे लगता है कि हम गैस्ट्रो की जब बात करेंगे तो डॉक्टर मंजीत त्रेहन का नाम सबसे पहले आएगा. तो एक बार जोरदार अभिनंदन पुनः.
थैंक यू सर. जो आपने बात कही एक्चुअली ना, क्योंकि कुछ भाषाएं हमारी 500 साल पहले आई, फिर 10,000 साल, तो कई सारी चीज़ें ऐसे कि हम बात तो सेम ही कर रहे हैं, शायद हमें इंटीग्रेशन का सिर्फ इशू है. इट्स द लैंग्वेज में भी डिफरेंट, द वर्ड में भी डिफरेंट, द वे टू एक्सप्लेन में भी डिफरेंट, बट अल्टीमेटली तो प्रोबेबली ऑल ऑफ अस आर वर्किंग, एंड प्रोबेबली देयर आर सो मेनी ब्यूटीज विद अस, जिनको शायद हमें और बढ़िया करके डाटा ला के दुनिया के सामने रखने की जरूरत है कि हमारे पास है. अब बड़ी बारी मैं बात करता हूँ कि पैरासीटामोल की गोली जिसने बनाई, उसने अपने तक उसको सीमित नहीं रखा. ये सारी दवाइयाँ ओपन में आ गई. अब अनदर थिंग आई फॉरगॉट टू से कि हम कॉमनली कहते हैं कि जी मेरी इस चीज़ का साइड इफेक्ट नहीं है. हम फिजिक्स में एक चैप्टर था 7वीं 8वीं, इफ आई रिमेंबर द से, द ग्रास हैज़ गॉट नो कलर व्हेन नोबडी इज लुकिंग एट इट. तो अब अगर मैं किसी चीज़ का साइड इफेक्ट स्टडी ही ना करूं और मैं बोल दूं साइड इफेक्ट नहीं है, वो गलत बात है. अब जब भी एक ड्रग मार्केट में कोई भी वट एवर मे बी सिस्टम, तो द रूल इज़ कि वो पहले उसके एक्सपेरिमेंटल डाटा होता है, फिर जब पब्लिक में भी जाती है एंटायर डाटा इज कलेक्टेड. फॉर एग्जाम्पल, a drug for weight reduction came, excellent weight reduction. Within a year or two we got, it has got a higher suicidal tendencies, so it should be stopped, it was marketed. अब अगर किसी ने उस सुसाइड को रिलेट करने की बात ही ना, ग्लोबली ये डाटा आया एंड देन इट वाज रियलाइज कि जितने लोगों ने ये गोली शुरू की थी उनमें कंपैरेटिवली सुसाइड बहुत ज़्यादा हुआ एज कम्पेयर टू दो उसके मैकेनिज्म ऑफ एक्शन में लगता नहीं था. तो इट्स वेरी इंपॉर्टेंट फॉर अस कि हमें अपनी बात को 24 कैरेट कहने से पहले मैं खुद 24 कैरेट उसको प्रूव करता हूँ. सारे बंदे देखो यार, चेक करो मिलावट तो नहीं है. तो जब मेरी बात 24 कैरेट है तो फिर मैं दुनिया के सामने छाती ठोक के उसको लाऊंगा और उसके बाद लेट एवरीबडी एक्सेप्ट इट. तो दैट्स द ब्यूटी. तो हमें अगर साइड इफेक्ट किसी भी चीज़ का, और हमारी देखो जो हम खाना खाते हैं घर में, अभी वीट एलर्जी की हम बात कर रहे हैं, लोगों को दूध से इशू है, घी से इशू है, तेल से इशू है, मीठा हम दुनिया का बंद करने पे उतरे हुए हैं इस समय. तो वो ईटेबल्स हैं, अगर उनके साइड इफेक्ट हो सकते हैं. जितनी दवाइयाँ हम सीरियस साइड इफेक्ट को ट्रीट करने के लिए यूज़ करते हैं, उनके खुद के साइड इफेक्ट हो सकते हैं. हमारी बॉडी अपने ऑर्गन्स को डैमेज करना शुरू कर देती है व्हेन वी टॉकिंग अबाउट ऑटोइम्यून डिजीज. तो कोई भी चीज़ इस दुनिया में जिसका साइड इफेक्ट ना हो, शायद ढूंढना वो बड़ा मुश्किल होगा वो. तो बट नोइंग द साइड इफेक्ट्स मेक्स अस बेटर प्रिपेयर्ड. मेरी कार का साइड इफेक्ट है अगर मैंने उसको अनकंट्रोल्ड स्पीड पे चलाया. वही कार है जो पिछले 20 साल से मेरे को चंडीगढ़ में घुमा रही है, और मैंने पंगा ले लिया, मैं बिना हेलमेट के ट्रैवल किया, तो उसी स्कूटर का साइड इफेक्ट हेड इंजरी हो सकता है. द ओनली थिंग इज दैट स्टडिंग दैट, knowing that side effects help us in better utilizing that armamentarium. Thank you. Thank you very much.
धन्यवाद डॉक्टर मंजीत जी. जैसे उन्होंने कहा कि दूध भी ज़्यादा पिया जाए तो वो लैक्सेटिव का काम कर जाता है, पेट को खराब कर देगा. कोई चीज़ यदि बहुत अमृत भी लिया जाए ज़्यादा मात्रा में तो वो जहर का काम करता है, और जहर भी यदि सीमित मात्रा में लिया जाए होम्योपैथी में तो वो अमृत का काम करती है. तो मात्रा भी बहुत, उसकी कंपोजिशन, उसकी डोज भी बहुत इफेक्टिव है. तो आदरणीय डॉक्टर मंजीत जी ने बात कही, मैं उससे 100% सहमत हूँ. एविडेंस बेस्ड होनी चाहिए, और जब हम बात करें तो डोज बेस्ड भी होनी चाहिए, और वो एज बेस्ड और डोज बेस्ड जब हम बात करते हैं तब जाके वो इफेक्टिव होती है. तो अब आप पहले लंच करना चाहते हैं या सेशन कंटिन्यू करना चाहते हैं? ठीक है, ओके, डन. तो एक बार हम जरा ऑनर करते हैं स्टेज पर, उसके बाद आप लंच के लिए जाइएगा. और एक अच्छी बात यह है डॉक्टर मंजीत सिंह जी, आपकी कोई ज़्यादा परिचय के मोहताज नहीं है. आदरणीय हमारी जो प्रिंसिपल मैम हैं डॉक्टर सुखपाल, उनके हस्बैंड हैं. इस नाते भी एक बार जोरदार अभिनंदन. ये मैंने इसलिए बाद में बताया कि जब आप लोगों का आज है ना रिस्पॉन्स, उसके बाद मैंने बताया, आपके साथ शेयर किया. और हमने स्पेशल रिक्वेस्ट करके उनसे लिया, क्योंकि इतने बड़े व्यक्तित्व हमारे साथ जुड़ जाएंगे तो हमारी कॉन्फ्रेंस का लेवल बढ़ जाएगा. सो नाइस ऑफ यू. थैंक्स अ लॉट.
डबल तालियां. थैंक यू वेरी मच सर. वी वुड लाइक टू हैव डॉक्टर सुखपाल ऑल्सो. हाँ, कोरम पूरा करना है. ये इत्तेफाक की बात है कि सर मैडम के साथ एसोसिएटेड है एज हस्बैंड एंड वाइफ, पर कोरम तो कोरम है. साक्षी, कुलदीप है ऊपर क्या? लाइट्स ऑन करना. कुलदीप का नंबर है? Thank you. Thank you very much, ma'am. So, as per your request, we are breaking for lunch, जो कि हमारे शेड्यूल से थोड़ा हटके हो रहा है. So, sir, we join back after 30 minutes, right?